Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple sclerosis. What is multiple sclerosis? The definition of multiple sclerosis is as follows. Multiple sclerosis is an autoimmune demyelinating disorder characterized by episodes of disease activity separated in time that produce white matter lesions that are separated in space. Multiple sclerosis is one of the most common neurologic disorders in the United States, Canada, and in Europe. It also common in New Zealand and part of Australia. Incidence is higher in adults, peak incidence between the age of 24 to 20 to 40. Women are affected more than men in a ratio of 2:1. The lesion of multiple sclerosis is caused by autoimmune response directed against components of myelin sheath. So it is a disease of central nervous system and there will be demyelination. Myelins are present around the axons in between the nodes of brain barrier, so that myelin will be damaged in this disease process. The exact cause of multiple sclerosis is not known, but it is assumed that it is an autoimmune disorder with multifactorial components. It is found in particular part of the world and also found in the United States, Canada, and New Zealand, the Australia part of Australia as well as Europe, specifically the Western Europe. And the disease is more common in the young population, specifically in the female. Okay, so what is going on here? This is the normal neuron. Here, this is the neuron of a patient of multiple sclerosis. Again, cell body of the neuron. This is the axon. These are the dendrites. Here, this is the myelin sheath. So there is some autoimmune mechanism from the T cell that secretes cytokine, and B cell, B lymphocyte secretes some type of chemicals that will attack the myelin here, myelin sheath, and myelin will be destroyed. So there will be no saltatory movement of the nerve impulse. So this is a normal neuron. This is a neuron of the multiple sclerosis. This is the axon. These are the dendrites. This is the cell body. Okay. And what happened? This is damaged. If we go to the MRI, we'll see multiple plaque formation. What are these plaques? Plaques are composed of degenerated myelin and also the macrophages and lymphocyte. And this plaque will be inactive at one time and it will be surrounded, or it will be in close proximity to gliosis, that is the proliferation of the astrocyte, the neuroglial cell proliferation. There will be gliosis around the plaque area. Okay, so we got the pathology. We'll go to the pathology. Multiple sclerosis is a multifactorial white matter disease. White matter is composed of axon, the supporting cell, neuroglia, and blood vessel. White matter is present inside the gray matter, that is the medulla of the brain. It is present on the outside the spinal cord around the gray matter. Okay, so here is the problem. It contains the axon. Axon contains the myelin. That myelin is damaged. Plaques are common near the ventricle, optic nerve, optic chiasm. Optic chiasm is the area where some fibers of the optic nerve, the nasal fiber crosses, goes to the other side. Brain stem, that is the midbrain pons and medulla oblongata. Ascending and descending fiber tracts, cerebellum and spinal cord. will be affected, will get plaque there. When the inflammation subsides, plaque is inactive, there will be proliferation of astrocyte. We call it gliosis. Gliosis, that is the proliferation of neuroglial cell, okay, like the astrocyte. Okay, so this is the healthy neuron, nothing wrong there. Okay, and patient of multiple sclerosis, optic nerve will be affected. That may lead to visual disturbances. I mean, it may lead to blindness. Okay, and it goes to the spinal cord. Okay, spinal cord is also affected. In case of multiple sclerosis may be affected, and sense will be lost. There will be paresthesia, and there may be abnormal sensation on the skin here, and muscle will be weak and uncoordinated muscle, the lower limb and the upper limb. Brain, okay, brain will be affected, will get plaque. In MRI will get multiple plaque. Mouth and speech will be disturbed because of involvement of the cranial nerve in the brain stem, so that mouth and speech and tongue will not move properly. Okay, there will be problem also in the digestive system. Again, the spinal cord is not working. Okay, nervous system is not working, and there will be dysfunction of the urinary bladder, and because of the sphincter mechanism does not work because of disturbed nerve supply. There will be altered sensation. There will be paresthesia and numbness to the limbs. And myelin is destroyed. We are seeing the myelin. Myelin is destroyed by some autoimmune mechanism. Symptoms and signs of multiple sclerosis. Symptom: paresthesia, numbness, hemiparesis, monoparesis, blurred vision, diplopia, that means double vision, blindness is possible because optic nerve is involved. Gait disorder, that happens because cerebellum and the vestibular apparatus is not working properly. Limb, both upper limb, upper extremity, lower extremity will show weakness and incoordination, again due to nerve disturbance, and as well as the cerebellar disturbance. Signs: upper motor neuron lesion, so we may get the Babinski's sign. Okay, we'll get Babinski's sign: spasticity, increased deep tendon reflex, like that of the knee jerk. Okay, and ankle jerk. Ataxia will be present because of cerebellar dysfunction. Bladder dysfunction, incontinence is possible, sphincter mechanism does not work, there will be sensory loss. Lhermitte sign, the person touches the chin to the chest, there will be some shock-like sensation go through the body to the lower limb. This is the Lhermitte sign. Okay, we got the signs and symptoms. Okay. What are the workup? How can we diagnose multiple sclerosis? We study the cerebrospinal fluid by lumbar puncture. It is abnormal because of mild lymphocytosis and slight increase in protein concentration. CSF electrophoresis shows what? Presence of discrete bands in the immunoglobulin G, there is IgG region, we call it oligochronal bands. Electrocerebral response study like visual evoked potential or auditory evoked potential or somatosensory evoked potential study can take help for the multiple sclerosis. Imaging study of the brain, MRI of the brain shows plaques, and plaques are the collection of myelin and the chronic inflammatory cell like that of the macrophage and the lymphocyte, and the myelin forms the plaque. And we'll also get gliosis around the plaque. There is the proliferation of the astrocytes. Okay, treatment should be given by a licensed physician, okay, specifically the neurologist, okay, can give the treatment, and he should be a medical physician, no doubt, a neurologist. So we have many drugs, for use. But first of all, we must give the patient health education, how to help themselves, and seek medical advice. So management by steroid like methylprednisolone, interferon beta A or interferon beta 1B. Some cytotoxic drug is also useful like methotrexate or azathioprine. Okay, monoclonal antibodies, especially for the relapsing condition. Baclofen is used to in case of spasticity. Carbamazepine is used to manage chronic pain. Oxybutynine used in case of bladder dysfunction. And due to fatigue, we use the medication amantadine to help person to prevent or decrease fatigue. Okay, so that's all about the treatment of the multiple sclerosis. Treatment should be again done by the registered physician, specifically the neurologist. Okay, and that's all about the multiple sclerosis. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.